Well, good afternoon, everyone. It's a pleasure to be here today and share a bit about chikungunya and the growing burden of disease related to arbovirus. So let me start off first by mentioning that chikungunya virus, or CHIKV, is a serious and debilitating mosquito-borne viral infection that poses a significant unmet need globally. CHIKV is transmitted to humans by mosquitoes belonging to the Aedes genus type. We have Aedes aegypti and Aedes albopictus, mosquitoes that are primary vectors responsible for the transmission. CHIKV infections are associated with acute and a chronic illness that causes substantial morbidity among infected individuals. A very high percentage of infected individuals become symptomatic. It is estimated that up to 97% of individuals infected suffer from acute symptoms. These include sudden onsets of high fever and oftentimes severe joint pain with swelling that usually begins between 3 to 7 days and can last for many years. Many patients experience debilitating long-term consequences of infection. With approximately 43% of these patients that are infected will suffer from chronic CHIKV and experience symptoms lasting months to years after initial infection. There has been one retrospective analysis published last year. It reported that up to 57% of patients are still affected by the disease after 2.5 years. Another study reported that 79% of individuals have persistent muscle and joint symptoms more than 2 years after the infection. We also see that in rare instances, these infections are associated with neurological symptoms such as altered mental status, seizures, and motor and sensory issues. Severe infections can also affect the heart, resulting in heart failure and arrhythmias. Chikungunya has meanwhile spread globally and is currently regarded as one of the most likely viral infections to emerge in new geographic areas due to its explosive and rapidly moving, but not predictable epidemics. An issue which raises an urgent need for efficient prophylaxis, as no approved vaccine or antiviral therapies to protect against chikungunya virus infections and to defend against outbreaks exist. Chikungunya virus has been identified in more than 100 countries across 5 continents. Chikungunya was first described in Tanzania in 1952. The word chikungunya means that which bends up. This is in reference of the stooped posture of patients affected by the severe joint pains. A mutation during a 2005 and 2006 outbreak showed that the virus enhances transmission, allowing for its spread from tropical to temperate regions, including Europe. Since then, these mosquitoes have rapidly spread the disease in more temperate climates where it has not previously been a problem. Today, it is estimated that more than 75% of the world's population lives in areas at risk for CHIKV infections. These outbreaks highlight the risk of importation of virus into new geographic areas and the explosive nature of the outbreaks that occur as a result. Most concerning is that modeling now shows the problem may only get worse due to global warming and climate change. As the Earth's temperature continues to rise, we are likely to see vector habitats expand, which pose an immediate risk of outbreaks in warmer areas in Europe. As shown on the map, you can see the current distribution of the Aedes albopictus, with the countries shaded in red representing an established presence of the mosquito. Yellow show an introduction of the mosquito, and green where the population of the mosquitoes is currently absent. A notable event was the rapid spread of the virus in Italy by a single infected traveler from India in 2007. More than 160 cases were virologically confirmed in 2 neighboring villages, and zero prevalence studies estimated that approximately 10% of the inhabitants in these communities were infected during this massive outbreak. These outbreaks highlight the risk of importation of virus into new geographic areas, as I mentioned before, and the explosive nature of the outbreaks that occur as a result. The ECDC stated the likelihood of introduction of the virus to continental European countries through a viremic travelers returning from an endemic, subtropical, and tropical countries is high. To summarize, since its reemergence, CHIKV has spread throughout the world, affecting millions of people, as seen from the latest outbreak that occurred earlier this year in Paraguay, with approximately 138,000 cases and around 114 deaths confirmed to date. CHIKV is a major threat to global public health due to its ability to cause large, explosive, and unpredictable outbreaks that affect up to 75% of the world's population. Chikungunya disease is very relevant to UK as a global travel hub with strong ties to Asia, Africa, and West Indies. With the increase in travel to, from, and within Europe, the chikungunya virus poses a public health threat in the region, specifically if co-infections occur with other vector-borne diseases such as dengue virus. If there's one thing that I've learned studying and tracking vector-borne diseases, it's that we should not try to predict them, but we rather prepare for them, because it only takes one infected individual to establish disease transmission among our local mosquito population. And once established, as we've seen in other countries around the world, the spread of the disease can be hard to stop. Thank you very much.